Good afternoon and welcome to Outer Cape Health Services webinar. I am Dr. Damien Archer, a community family medicine physician and the CEO here at Outer Cape Health. It's a true honor to host this webinar today alongside three incredible individuals who support our community health center's mission on the Lower and Outer Cape. I'm joined by our president and board chair, Larry Ballantyne, our Chief Strategy Officer, Kate Swanson, and our Chief Medical Officer, Dr. Marie Constant. Thank you, Larry, Kate, and Marie, for joining me today. The goal of this webinar is to inform you, our patients, and community stakeholders about the unique role Outer Cape Health Services plays as a rural and federally qualified health center. We'll share the work we've been doing and our plans for the future to enhance the quality and access to the wide range of healthcare and supportive social services we offer. To kick things off, I'd like to invite Larry to share some background about who we are, our mission, and our vision as an organization. Larry?
Thank you, Damien. Hello, everyone. I'm Larry Ballantyne, the chair of the board of Outer Cape Health Services. Thank you for joining us for this community webinar. Today, we're excited to share information about the vital services of Outer Cape Health provides the Outer and Lower Cape. At Outer Cape Health Services, our mission is clear. We strive to offer a full range of primary health care and supportive social services that promote the health and well-being of everyone who lives in or visits the 10 outermost towns of Cape Cod. Our commitment to this mission has guided us for over 50 years, ensuring that no one is denied access to the care they need, regardless of their ability to pay. In December 2023, our board of directors took a significant step forward by approving a strategic plan that will direct our efforts through the end of 2026. This plan is designed to address the evolving needs of our communities and ensure we continue to deliver high-quality health care. The plan is built around three core pillars. The first, patient experience and quality of care. We aim to continually enhance patient access, improve overall satisfaction, and ensure excellent clinical outcomes by increasing our clinical capacity and building effective teams. We can expand our healthcare delivery through innovative approaches. The second core pillar is workforce experience and employee satisfaction. Our staff is our greatest asset. We are dedicated to improving leadership, employee engagement, communications, and retention. By offering competitive benefits and fostering a supportive work environment, we aim to make Outer Cape Health the preferred place to work in our communities. The third pillar is community engagement, population health, and health equity. We recognize the importance of collaborating with community partners to address health disparities. Our plan includes investigating new clinical partnerships and expanding our equity programs, ensuring that we engage directly with community stakeholders to improve health outcomes for everyone. All these initiatives rest on a solid foundation of financial stewardship. We have appointed Dr. Damien Archer and his experienced management team to execute this plan effectively. Their leadership will be vital as we navigate the challenges ahead, ensuring that we remain a reliable source of accessible, high-quality care. As you'll hear today, Outer Cape Health Services has continued to rise above these challenges, solidifying a role as an invaluable provider of low-barrier health care for residents and visitors alike. We are committed to making sure that everyone in our community has access to the care they need, especially as access to primary care becomes increasingly challenging, not just in Massachusetts, but nationwide. It is often said that healthcare of a community is its wealth, and we take this to heart. We are dedicated to providing healthcare, high-quality healthcare and supportive social services, and we are committed to ensuring that we remain a steadfast resource for our community for decades to come. On behalf of the board, I invite you to stay engaged, become a vested partner with us with whatever suits your interests. Your support is crucial, and as we continue to work towards our mission, we meet the health needs of our community. Dr. Archer, I'll turn it back to you.
Thank you, Larry. As the CEO, I'm reminded of the words of our mission statement on a daily basis because it helps me navigate the challenges of each day and ensures that I'm focused on our goal, providing comprehensive primary care and supportive social services to everyone in our community. Now, I'd like to invite Dr. Constant to give us an overview of our services and how we're evolving our care model to better meet the needs of our patients and the community. Dr. Constant?
Thank you, Dr. Archer. Good afternoon, everyone. Thank you so much for joining us today. I'm Dr. Marie Constant, Chief Medical Officer and Provincetown Site Medical Director at Outer Cape Health Services. I'm excited today to share an update on the care and services we provide across the Outer Cape. As Damien mentioned earlier, our mission is to deliver high-quality primary care and supportive social services to the communities across the 10 outermost towns of Cape Cod, from Yarmouth all the way to Provincetown. We operate across 3 main clinical sites: Harwich Fort, which is conveniently located on the Cape Cod bus route, Wellfleet, just off Route 6, and Provincetown, which is open Monday through Saturday for in-person care. We also have an additional site, the Wellfleet Pharmacy, and the AIM and Wellness Center in Wellfleet. It provides recovery services and outpatient behavioral health care. At OCHS, we are committed to serving a high volume of patients while upholding the highest standard of care. Between February 18, 2024 and February 18, 2025, we cared for close to 23,000 registered patients, from newborn, just 5 days old, to community members, 105 years old. We provide a wide range of services, from primary care to specialty services and pharmacy. You can find a full list on our website at outercape.org, but I'd like today to highlight a few here. Our primary care services include family medicine, pediatrics, adolescent health, and women's health. And all of those services are available at all 3 sites. In specialty services, we offer infectious disease specialists, endocrinology, dermatology, optometry, gynecology, radiology. In radiology, we offer X-ray, mammogram, and bone density scans. In our behavioral health and psychiatric department, we offer individual therapy, family therapy, and group counseling, as well as psychiatric services available both in person and via telehealth. To better meet our patients' need, we offer extended hours. On Thursdays, all 3 sites are open until 6 p.m. for in-person care. On Saturdays, our Provincetown location is open. On Sundays and weekdays evening, we have telehealth that is available until 6:30 p.m. In terms of population health, we closely monitor disease trends in the community, and we work very strongly to keep our staff, patients, and the community informed through education and prevention efforts. We are also rolling out a team-based care model. This approach provides more personalized and coordinated care, with providers working together to support better health outcomes for every patient. At Outer Cape Health Services, we remain deeply committed to delivering compassionate, high-quality healthcare. We're always working to improve access and enhance the care we provide. Thank you again for joining us this afternoon, and I'll give it back to you, Dr. Archer. Thank you.
Thank you, Dr. Constant. Next, I'd like to invite Kate Swanson to share with us how we support our services through our day-to-day operations and how we've evolved over the past year and our plans to meet future challenges to ensure safe and effective care. Kate?
Thank you, Dr. Archer. Good afternoon. I'm Kate Swanson, the Chief Strategy Officer at Outer Cape Health Services. I oversee our operations and finance teams, and today I want to share some important updates about our progress in improving our systems and services, as well as an overview of how our health center is supported financially. Looking back at 2024, we undertook thorough reviews of our operations and financial workflows to identify opportunities for improvement. As a result, we made significant enhancements in several areas. For instance, we revamped how we handle new patient requests, improved our referral systems, and upgraded our call center services. We also updated our financial and administrative processes, which has allowed us to deliver better care to you. One of the most notable achievements came from our efforts to address a significant patient waitlist. Between spring and fall of 2024, we tackled a waitlist of over 1,000 patients. This was no small feat and required a clinical operations approach with our practice management team, partnering closely with our medical directors and our primary care clinicians to expand patient capacity across all 3 clinical sites and develop a streamlined process to bring in new patients. However, the demand for primary care continues to outpace the supply of clinicians, especially in rural areas like ours. The healthcare landscape is also challenging, and we are actively collaborating with other organizations to identify best practices and innovative solutions to improve access to care so that we can continue to bring patients in as quickly and as safely as we can. As you heard from Dr. Constant, we are doubling down on our efforts to enhance access to care, ensuring a better experience for patients while also taking care of our healthcare teams to prevent burnout. As a rural and federally qualified health center, we have a special privilege to provide care to everyone, regardless of their ability to pay. This is a cornerstone of our mission, and achieving it requires substantial financial support from various sources. We rely heavily on federal, state, and local town grants, as well as generous donations from community members, many of whom are also our patients and advocates for our services. While we continue to advocate for better reimbursement models for primary care, it's important to understand that the current funding structure for billable care alone does not cover the wide array of services that we offer, nor does it keep pace with external market factors like inflation and the extreme cost of housing on the Cape. We are committed to maximizing our revenue opportunities in alignment with our mission, while also being vigilant with our expenses. We do this because our most valuable resource is also our most expensive one, our people. It is our dedicated staff who provide the compassionate care that our patients need to achieve their healthcare goals. As we look to the future, we continue to build on the foundation laid in 2024. Our focus will remain on improving our operations and enhancing access to care. We are committed to building effective teams that support high-quality patient services and employee satisfaction. I look forward to sharing more about our progress and achievements as we continue to serve our community. Thank you for your interest in and support of Outer Cape Health Services. Together, we can ensure that we remain a reliable source of care for everyone in our community for years to come. Thank you, and back to you, Dr. Archer.
Thank you, Kate, for sharing our commitment to providing the best possible experience for our patients and the community while being responsible with our limited resources. Now I'd like to turn it back to Larry to wrap up this portion of the webinar. He'll talk about the significance of engaged community partnerships and helping us elevate our care and staying informed about what matters most to the people we serve. Larry?
Thank you, Damien. One advantage or privilege of being the chair of the board of directors, I get to speak twice on this in this session. And as Damien has mentioned, an item that's very important to us in our organization is, and to the community, is the critical role of community engagement and partnership in ensuring health and well-being of everyone living or visiting the Outer Cape, Outer and Lower Cape towns. At Outer Cape Health, we know we can't do this alone. Ensuring that we continue to meet the needs of our community requires strong relationships with our patients, our community members, local leaders, and other organizations. Together, we can create the momentum needed to build a better community, even in the face of the challenges. Research shows that community health centers like ours have a significant impact on the health of the people we serve by providing exceptional care to everyone, regardless of the ability to pay. However, we can't achieve this impact without the support and resources that our community members and our stakeholders provide year after year. Together, we face significant challenges: rising healthcare demands, increasing costs, a shortage of providers, and growing barriers to access for our most vulnerable populations. As these challenges increase, the need for active community partnership becomes even more urgent. Our strategic plan focuses on enhancing patient experience, workforce satisfaction, and community engagement. Each of these areas relies on your involvement. We're not just seeking your support, we're inviting you to be part of a movement. By engaging with us, you help ensure that our programs and services are relevant and meet the specific needs of our community. Together, we can advocate for policies that promote high-quality health care for everyone. In 2024, we launched initiatives aimed at strengthening our community partnerships and increasing and showcasing the impact of Outer Cape Health has on the health of our residents and visitors. Your involvement, along with that of local organizations, is vital for expanding our reach and effectiveness. We need your voices, your ideas, your energy. Whether it's participating in community updates like this one, or sharing your experiences and needs, your engagement is essential. You are the heartbeat of our community, and your input drives our mission forward. Looking ahead, we see a future filled with both challenges and opportunities. These opportunities require resources and support. We need engaged partners who will stand with us as we navigate the complexities of the healthcare landscape. So I urge you to join us in this vital work. Consider giving us the gift of your time, financial support, or expertise. We need all three. Let's collaborate, innovate, and advocate for the health of our community together. Your involvement is crucial to ensuring the Outer Cape Health Services remains a reliable source of care for everyone. Thank you for taking the time to watch this webinar. I look forward to your future engagement to ensure Outer Cape Health continues to meet our healthcare needs for the years to come. Now, Damien, I'll return it to you.
Thank you, Larry, Kate, and Marie. We've shared who we are, what we do, and how we fulfill our mission as a community-focused primary care organization. Now, I'd like to open the floor for some Q&A. Thank you to everyone who submitted questions in advance of the webinar. I've also been keeping an eye on those questions and comments that have come through as we were sharing about our organization with you today. I hope to address some common themes to provide as much information as possible, even if it isn't possible to get to every single question that we've had. So with that, I'd like to start with one question that has come up, and I think it's on everyone's minds at this current time. And that question has to do with the impact to Outer Cape Health from any of the recent federal actions. So there are three key areas that I'd like to address with this question. One is our funding. Recently, there were concerns about a pause on federal funding, but I'm relieved to share that we are currently receiving all of our federal grants without disruption. However, because of the systemic underinvestment in primary care, most health centers like Outer Cape Health operate on very tight margins. Therefore, any prolonged disruption in revenue can lead to difficulties. We are closely monitoring our funding and are proactively planning to minimize any potential impact on our services and operations. With regard to our staff and services, we remain committed to fulfilling our mission of providing care to the communities we serve, regardless of one's ability to pay. And we are actively working to address concerns that our staff may have about the ongoing care and services we provide to our patients. At Outer Cape Health, we are navigating changes in policy by focusing on maintaining our capacity to provide exceptional care to everyone in our community. And for our patients, we have heard that there is some apprehension about seeking care. I want to reassure everyone that our mission as a healthcare provider is to provide safe and accessible care to everyone that lives in or visits the Outer and Lower Cape. If you need health services or support, please don't hesitate to reach out to us. It's crucial to prioritize your physical and mental health, especially now. The next question I will ask Kate to address. And Kate, the question is, looking ahead, how will Outer Cape Health Services meet the demand for health care given the challenges of funding and difficulties in recruiting and retaining staff?
Thank you for the question, Dr. Archer. Well, it's difficult to provide a precise answer due to the many variables at play. OCHS is committed to a thoughtful, strategic, and inclusive approach to addressing challenges to our current ability to provide care to the communities of the Cape. That's one of the reasons why we're hosting this community webinar today. What I know for certain is that our ability to overcome current and future obstacles relies heavily on the support of our community and our patients. I truly believe that OCHS has some of the most dedicated and community-focused staff with whom I've ever worked. We are committed to solving problems together, bringing as many perspectives to the table as possible to find the best possible solutions that meets the needs of our patients, staff, and communities, all in service to our mission. This collaborative spirit has already led us to successfully launching our journey towards team-based care, improving our referral process, and reducing a waitlist that exceeded 1,000 patients last year. While we may not be able to tackle everything at once, some areas may take precedence over others due to our limited resources as a community health center. I want to assure everyone that we are working diligently to sustain and improve our services for all who need us for as long as possible.
Thank you, Kate. Marie, the next question's for you. How is Outer Cape Health Services working to improve access to specialist care on the Outer Cape?
Thanks for the question. I want to start by thanking our referral team for their outstanding work in speeding up the internal process of referrals to specialists outside of our health centers. Currently, our referrals are generally processed within 1 week. Despite their efforts, we still face a general lack of access to specialists in most fields across the region. To address this challenge, we have explored innovative ways to bring necessary care directly to our patients by offering endocrinology and psychiatric care to telehealth. Outer Cape Health Services has launched integrated psychiatry and endocrine specialist programs that enhance the capabilities of our primary care team. This initiative not only improves the quality of care, but also provides better access to psychiatry and endocrinology specialists for diagnostic and treatment needs. Both our staff and patients have reported high satisfaction with this model, and we plan to continue supporting it as long as it remains feasible and sustainable. However, I want to emphasize that implementing such innovations requires external support. We are especially grateful to the Lily Lulu Foundation for their assistance in launching our endocrinology program last year, which has significantly improved access to care for individuals living with type 1 diabetes and other endocrine conditions on the Cape.
Thank you, Marie, for that response about how we are meeting the challenges by innovating. Larry, this question's for you. What can patients and community members do to help Outer Cape Health at this time?
Thank you, Damien. It's a broad question, and we've mentioned some of this in our previous discussions. But number one is be engaged. Bring to us any suggestions you have, information. Spread the word of Outer Cape Health. We have a very passionate and engaged board of directors. You can find their names on our website. Contact any of those as well. But that moral and substantial support is needed. And as we've talked before, finances are always a necessary aspect to be sure we can do meet our mission requirements. Any financial help that you can provide will certainly be gratefully accepted. And just continue involvement with all of us would be the most important thing.
Great. Thank you for that, Larry. Right now, community is everything to all of us, and staying engaged, staying in connection with us as a healthcare provider for the majority of the people that live on the Lower and Outer Cape, I think, is definitely the way to go. Kate, I will ask you another question, and that is, how is Outer Cape Health Services addressing long wait times for primary care and specialist appointments?
Thank you for the question. Outer Cape has been and will continue to implement innovative strategies to optimize scheduling workflows and manage patient panel sizes. The organization has made significant strides in operational improvements, resulting in decreased primary care patient wait lists, and increased appointment availability. Again, as I mentioned earlier in our discussion today, we do continue to see patient demand outpace the supply of providers, so we will continue to bring in patients as quickly and as safely as we can.
Thank you, Kate. As we shared earlier, there's a nationwide shortage of primary care, but we are not going to allow that challenge be something that we're not going to do our best to overcome. And so, as you said, we will bring folks in as quickly and as safely as we can. We understand that that is our mission, and we're committed to that. And Marie, I'll give the last question to you. This is top of mind for many people. There has been a lot of concern about measles. Can you share what people should do to stay safe and healthy at this time?
Yes. Measles is a highly contagious virus. If one child or an adult is infected with measles, they can infect 18 people who are not vaccinated. This is how contagious that virus is. It presents with a fever, runny nose, cough, and redness in the eyes, conjunctivitis, followed by a rash. The rash starts on the face and moves down the body. It can have serious effect on the health of people, such as pneumonia. It can also cause a brain infection called encephalitis, and in extreme cases, it can cause death. Young children, elderly people, and people with impaired immune system are particularly at risk. The most important thing you can do to prevent measles is to get the MMR vaccine. If you are unsure about your vaccination status, please contact your primary care physician or consider reaching out to us to check your immune status or get immunized. The MMR vaccine we use today and that we have used since 1968 is 97% effective after the 2-dose series. For most people, the U.S. adult immunization schedule recommends that if you don't have any written documentation that you received the 2-dose series in childhood, or if you don't have lab evidence of immunity, you should get 1 dose of MMR vaccine. However, if you are a healthcare personnel, if you plan to travel internationally, if you are high school or college students, you should receive 2 doses of vaccines. If you are concerned that you may have measles and you are a patient of OCHS, please first call us before you come into the office. We'll offer you a telehealth visit and guide you towards your treatment. If you do not have a primary care clinician, you can also call your local board of health or the Department of Public Health at 617-983-6800. Thank you, Dr. Archer.
Thank you, everyone. And with that, it's time to close the webinar. Thank you for listening in and sharing your questions and time with us. We hope that this webinar has been informative and provided you with ways to stay engaged with us to support our mission of providing high-quality healthcare and supportive social services to the Outer and Lower Cape. In addition to this webinar, we have also posted on our Outer Cape Health Community website an update document that should help to answer any additional questions that you may have. Please feel free to share the links to our recording and the community update document to those that you think will benefit from watching, listening, and reading more about the ways we are fulfilling our mission to the communities we serve. And please remember, if you have questions about our organization, feel free to reach out to us at communications@outercape.org. That's communications@outercape.org. And if you are interested in supporting us in other ways, email our development team at development@outercape.org. That's development@outercape.org. Or you can simply Google Donate to Outer Cape, which will take you to our Ways to Give website. And to our patients, thank you. If you have questions about your immediate healthcare needs, please continue to use MyChart or call our call center to be connected to your care team at 508-432-1400. That's 508-432-1400. My thanks again to Larry, Kate, and Marie for joining me today for this webinar. We look forward to keeping everyone healthy, safe, and engaged. Bye for now.